So, good morning. We are here with the fellow of this month, Dr. Andrea from Austria. Good morning, Andrea. How are you doing?
Good morning. I'm doing very well. Thank
Okay,
you.
great. So she stayed with us 2 weeks so far, hopefully more time. But Andrea, please introduce yourself. At which point of your career are you? How did you find me?
So I am from Austria. I studied medicine there. And then I trained for almost 4 years in Switzerland in reconstructive or anesthetic surgery. I spent almost a year in South Africa in a public hospital where I was exposed to a lot of reconstructive trauma surgery. And the last few months, I trained with Dr. Macia in a breast fellowship in Barcelona, where I met Alberto Lopez, who's now a colleague of yours and a friend of mine, and he recommended me to you.
That's very nice. I must say thank you, Alberto, for sending you to me. It's a pleasure. So this time it was not from internet; it was by word of mouth, it's a great pleasure and honor for me. So, what have you seen so far with us? What kind of surgery? Because people want to know what is the real experience here.
So I've seen a lot of body contouring and breast and abdominoplasties, as well as a wide range of facial surgery, especially nose. I think that's your
quite some
that's
noses. Yes, quite some noses. Yes, indeed.
Yes, no, I've seen and learned a lot of you, and you actually very eager to teach to the fellows, which is very pleasant, I have to say.
Thank you for saying that, because obviously when you come to a fellowship, you don't know what kind of teaching you're gonna get. And I promise that I do my best to share all the things that I think they're valuable tips and tricks. This is very important. And we are spending nice time between colleagues and then friends, where eventually we all become friends in the OR. We are already opening the position for our great fellowship program of aesthetic surgery. And please send us an email to the email below and send your CV, your application letter, and the period you want to come. If you are a resident in plastic surgery or a young plastic surgeon, you are mostly welcome to join us during our daily activity. I remind you that most of our activity is about rhinoplasty, almost 50% of our volume. But it's also about aesthetic medicine, mastopexy, breast surgery, body contouring. We do a whole plethora of procedures that will enrich your experience with us, both in surgery, in the OR, and in our consultation. If you don't have time, there's still a chance you to come for a few days for an observership. Probably less involving, you'll be just observing our practice, but it will give you the chance to stay with us between 1 to 5 days for a short period of time and take a quick look at what we're doing and learn on a daily basic practice.